Welcome to another edition of Core Health. My name is Zibironke Ira Lovigbe. On today's program, we'll be talking antenatal care. Antenatal care, also known as prenatal care, has been proven to reduce maternal mortality and mobility. It also allows for risk identification to prevent or identify and treat any condition that may threaten the health of the baby or the mother. Our guest for today is a specialist obstetrician gynecologist, Deji Omolona, who will give us insight to what antenatal care is all about, benefits of antenatal to pregnant women, and diseases associated to pregnancy, which pregnant women should watch out for. Stay tuned.
So antenatal care is a care given to pregnant women to ensure best health condition for the mother and baby during pregnancy, and so to say to ensure a safe motherhood. Ante is simply a prefix, and that's like before, and natal means birth. So antenatal care is care given to women before birth, that is during pregnancy. It actually involves 4 major components, which include risk identification. That is, you want to grade these women whether they are ones of low risk or high risk, because normally pregnancy is a physiological condition. Back in those days, if there's no problem with pregnancy, a woman can progress also pregnancy without intervention. But for the little fraction that can develop complications, that is why antenatal care is quite very important. And the thing is, you cannot by maybe a person's habitus or weight or maybe well-being to say, oh, this person, you are pregnant now, everything will go well for you. So anything can change in pregnancy. So that's why it's important. The second component, aside risk identification, it's prevention and treatment of pregnancy-related conditions and also concurrent diseases, which can include hypertension in pregnancy, diabetes in pregnancy. People can even have background asthma in pregnancy. There are also other conditions like malaria in pregnancy, HIV in pregnancy, hepatitis in pregnancy. Aside that, sure, also have urinary tract infection in pregnancy and respiratory tract infection in pregnancy. So all these conditions, if not treated, can lead to adverse outcome for the mother, likewise the baby. And aside that, also health education and health promotion is likewise important, in which you want to tell them about what to eat in pregnancy, exercise involved in pregnancy, avoiding common habits. Some smoke, some take a lot of alcohol. So all these things have adverse effects in pregnancy. So these are the core involvements of core components of antenatal care. As I said, risk identification, prevention and treatment of pregnancy-related and concurrent diseases, and also health education and health promotion.
For the pregnant women in the house, it's important to take antenatal care serious because its benefits cannot be underestimated, especially for the safety of your baby and you during and after delivery. Before we hear more on this, let's take a short break.
Coming together of opportunities, and this is what...
Infrastructure is the backbone of development, which explains the Buhari government's effort at bridging the facility gap. Infrastructure Weekly is a television package designed to bring you latest information on hundreds of development projects going on in various sectors all over the nation.
There is no state in Nigeria today where you will not see our contractors busy at work.
Power generation, rural electrification, road rehabilitations, national housing scheme, construction of roads and rail lines across the country, you name it.
We are now able to produce 7,000 megawatt of power. That is no longer debatable.
Infrastructure Weekly is Nigerians working together for a better Nigeria. So be better informed to take better informed decisions. Watch Infrastructure Weekly, showing on Channels Television, Thursdays 2:30 p.m., NTA Network Wednesdays 5 p.m., and Core TV News Fridays at 8 p.m. Infrastructure Weekly, making development known.
Welcome back. For those who are just joining us on the program, our topic for today is antenatal care, and we have been talking with a specialist obstetrician gynecologist, Deji Omolona, who will tell us what we need to know about what happens during the trimesters of pregnancy. Please join us. Let's look at the trimesters we have in pregnancy.
Okay.
The first,
the second and the third. Yes.
What are the things to watch out for during this trimester?
All right. That's a good question. As you said, the trimesters are for convenience broken into 3, and that is what the focused antenatal care actually tried to catch, in which the first visit is said to be between the 8 to 12 weeks. The second visit is between 24 to 26 weeks. The third visit is between 32 weeks, and the last visit is between 36 to 38 weeks. However, the visits can be more if there are complications that arises. Now, the first trimester is between conception, that's from when the patient gets pregnant, to the 13th week. The second trimester is between 13 weeks and the 26th week, while the third trimester is between the 26th week and the 39th week. Because averagely you expect a pregnancy to last at least 40 weeks, plus or minus 2 weeks. So the first trimester, it is very important that, because as I said, it's one of the most important parts, because that is where the baby actually forms. So drugs, external interference, probably raise, medications, lifestyle, ought to be carefully monitored in this first 13, because that is where the baby forms, the heart, the brain. If you can see this like this, this schema, just showing the development of the fetus, So between the 5th and that 13, between the 8th, 7th day and the 13th week, that is when that embryogenesis and organogenesis takes place. So that period is very critical. And when a woman presents in the hospital at this time, you want to date the pregnancy. That is because another problem in this environment is that women come in when they are late. And the best time to date a pregnancy is usually between the 9th and the 13th week, in which you can use the crown rump length. So at that time, most women will not even know when they get pregnant, because most pregnancies are not planned. So, and for you to avoid post-date pregnancy, which has its own complications, because a week difference between knowing when a woman gets pregnant or not can determine whether that baby comes out alive or not. Because at the later part of pregnancy, the placenta function has started reducing, which is the one that supplies nutrients to the baby. So dating is a key component of the first trimester. And also, you want to start them on folate drugs. That is folic acid, which is very important for neural tube development. So women need to, as soon as they get pregnant, they should just visit the hospital. Not like you're going to do them anything special. Just do a basic scan, know your blood group, and start taking your antenatal medications. And you now identify your risk factors, so that in case you need to see you more frequently, or you need to go to a specialized level of care. Now in the second trimester, now the baby is formed, baby is growing. In this part of pregnancy, that is when you now start having the common medical conditions start rearing up its head, because the placenta is formed, and majorly issues of placenta function or issue of metabolism or weight and all comes into play. So in that place, after the 28th week, you now start having, we can ask categorize, say, okay, if the woman was not hypertensive before that time, before 20 weeks, you can ask, and for example, hypertensive now, you can ask that patient has what we call gestational hypertension. That is pregnancy in hypertension in pregnancy, And we now start looking out for protein in the urine, which is not supposed to be there, because protein is a large molecule, so it's not supposed to pass through the basement membrane of the kidney. So once it starts passing through, you now start getting worried. Now that when you start having proteinuria and hypertension, you now call it preeclampsia, which is a multi-systemic disease and a disease of progression. So in that kind of case, you need close monitoring. So in second trimester, you want to monitor them for pregnancy-induced hypertension. You want to also, if patients has a risk factor for diabetes, you want to screen them again. You want to do your oral glucose tolerance test for them. You want to also screen them for anemia, and also ensure that they are taking their medications. And also, the another component of the focus on which they call the birth planning and emergency preparedness, in which you want to, the woman takes a decision, on, okay, he knows that dating, She knows where she wants to deliver. She knows who wants to deliver her. And it's very advised that a woman should be delivered by a skilled birth attendant, which means a nurse, a midwife, or a medical doctor. Then apart from that, she wants to make emergency funds available. When in case she has complications or falls into labor, who takes her to the hospital, who transports her, all those factors, because these are the factors that occur. That you find a woman, maybe they rupture their water, that they drain like her, and the husband is not at home. They keep waiting till the husband comes back home, and at the end of the day, probably they expel on the floor of the house, the baby dies, or the mother also starts bleeding. So facts like that is what has been inculcated, into this focal antenatal care, which makes it more engaging and involving the husband, the woman, and the doctor. So, and also now we're talking about the third trimester. We're not talking about, we want to check for malpresentation. As I told you that 3 to 4% of babies eventually end up as breech. So you want to know whether the baby is coming with the head. At that point, that's between at 36 to 38, we want to confirm baby coming, so that you know, okay, this baby, we can still go ahead with vaginal delivery. If the woman has delivered before, vaginally, if she's probably a second pregnancy or third pregnancy, she's coming with a breech, you can still go ahead and deliver her vaginally. But if it's a first timer, you want to advise her for a cesarean section. So all those factors, you want to also screen her for anemia again, because anemia is a very common, complication of pregnancy in this environment, because women caused by low intake of iron. No, iron containing foods. And if you eat very well, the women don't even need to to take as much iron supplement. But find out in this environment, even ab initio before pregnancy, the woman is even already anemic. That is, she's just a menstrual period, she's not eating enough, due to and now in pregnancy there's increased maternal red cell mass, there's plasma volume expansion, so a woman that is very probably borderline, like 30% before, when she gets pregnant, she can fall to like 26%, which is not good for the baby. So that's why, as I said, preconception counseling is very important. You have checked her, she's fit to get pregnant, she now gets pregnant. So we have to check. So that's why if the woman PCV is low, we start telling her to use ferrous, which is a supplementation, so as to boost the baby, to ensure good weight for the baby, and also prevent, complications in the mother, like uterine atony that can lead to postpartum hemorrhage, when the woman falls into labor.
Let's take a short break now. I'll be right back.
The judiciary, third arm of government. What happens here is what we give to you. The arraignments, arguments, rulings, adjournments of cases and judgments. The fight against corruption and issues bordering on human rights violations.
The doctrine of least spenders ought to have been respected, that no arm of government, however powerful, should take the laws into its hands as held by the Supreme Court.
Justice is one way. It's either you go for justice or justice go after you. But I've never seen a situation where an individual is afraid of justice.
We move from court to court to give you updates on legal matters, when they happen and where they are happening, going extra miles to get reactions from the parties, even when they are not in the mood to speak.
No comment. Talk to my lawyer.
Watch Legal Scope on Court TV News at this time.
Now, let's look at supplements to be taken during pregnancy and some words of advice for pregnant women out there.
Yes.
You mentioned the water that comes out before delivery.
Okay.
Can you talk more on that? Why most times some men will say they are water block for delivery? The water causes of how
okay.
And what's the essence? What's the idea of that water coming out before?
All right. So water breaking is what we call rupture of membranes. The membranes, the baby is protected, in the amniotic sac. By the membrane and the water, the amniotic fluid serves as a cushion for the baby in pregnancy, allows it to move, and also grow grow normally, turn, grow accordingly, and all. And it's actually the amniotic fluid is actually from fetal urine. the fetus passes urine, and and eventually it forms the amniotic fluid. So any problem with probably kidney function of the baby, or probably the swallowing reflex of the baby, swallowing reflex of the baby, because the baby also should be able to swallow that fluid, because it's just bathing in that fluid. So even if a woman also probably accidentally falls down or eats her tummy, that amniotic fluid, that water that I said breaks, is the one that cushions the baby against external aggression, rather than external force. So it's like a cushion for the baby. So anything that reduces that fluid, is a risk for that baby. So that's why in pregnancy we talk about, probably a woman starts complaining that the baby is not kicking well. You can say she can do a biophysical profile, want to check, because anytime the baby, that fluid is reduced, it's a warning sign for that baby. So when there are many causes of that water to break, it's called the premature rupture of membrane. Premature rupture of membrane is rupture of membrane at any gestational age before labor. So because we expect that is when contraction starts, then the water should break on its own and labor progresses. But if that water ruptures, if the amniotic sac or amniotic membrane breaks before labor and babies before time, then we say it's a premature rupture of membrane, or preterm pre-labor rupture of membrane. And the commonest cause is infection. Understand? Ascending infection from the genital tract. Some women, they're still involved in their polygamy, so the husband can probably involve in maybe extramarital affair, so give the woman infection. So any infection that colonizes the genital tract can ascend and weaken the tensile strength of that membrane. That sac is very thick, but with infection it can get weak. So when a woman starts having discharge, yellowish discharge, or any discharge that is normally of the normal physiologic, discharge that is just like normal milky white, kind of thing, your plain white, just transparent white, yes, patients should come to the hospital so that we can treat. Then even malaria or untreated infection can also cause rupture of membrane. And also women that are probably they have multiple pregnancies, because in this era we have in vitro fertilization, in which you have women that can carry twin pregnancy, triple pregnancy. That also reduces the distensibility, that is how the womb can get big. So it can also lead to rupture of membrane. So, but whenever a water breaks at any point, it is an emergency, and that woman should present in the hospital.
Can the water break anytime? Is it from the second trimester or the third trimester?
Yes, it can break at any time. Second trimester. No, in the first trimester, most times we usually categorize it based on age of viability. Okay. In this environment, our age of viability is 28 weeks. So if the water, and age of viability means that the chances that baby can survive outside the womb, the age that baby can say that, okay, from 28 weeks, we can say that if baby is even born at this time, the pediatricians or the neonatologists can take over the baby in the incubator and still make the baby grow to 10. Understand? But if the baby gets born before 28 weeks in this environment, we still classify that baby like an abortion. Understand? So, but if the water now breaks after 28 weeks, now we can now call it a preterm rupture of membrane. And eventually, if baby, we can do a conservative management, between that 28 and 34 weeks to allow for fetal lung maturity. And because eventually, once that water is not there, that place will be hostile to the baby, and eventually the baby will come out. But the little time that we can buy to allow the lungs to mature, we give relevant drugs like corticosteroids we can give. And when the baby now comes out eventually, we can now hand over to the pediatrician, having involved them at the time that the baby has a ruptured membrane, or we treat for infections and all. So, but from 28 weeks to 10, rupture of membrane baby can be treated as a baby. You understand? Because before 28 weeks, chances of that baby surviving is very slim. But abroad, in developed countries, they can still, like in America, their own age of viability is 20 weeks. In UK, it's 24 weeks. So a baby born at 24 weeks in UK can be saved. Though can not be referred to as a premature. It's a premature delivery, but can still be taken care of to depend that will be discharged home, but we can still have some residual issues, because we say that the womb is the best environment for the baby.
Now, to all women out there, especially for pregnant women, what they should know about?
Okay. It is said that health is the highest social capital for a nation, and a country that makes health, very important, is more economically viable. I would urge pregnant women to put their lives, that their destiny is in their hands. Antenatal care is cheap and is affordable. They should make use of the opportunity so that they will have, a healthy baby and also a healthy mother. Because it's not enough to have a baby that is not healthy. And antenatal care is good for them to prevent all these, unnecessary deaths for mother and child in pregnancy. So all our cultures, our religious leaders, to help us, tell them more that once a woman is pregnant, she should come to the hospital to book early, so that we'll be able to stratify her and monitor her accordingly, so that we have a healthy nation for mother, child, and fathers. Thank you very much.
If you're pregnant or thinking about getting pregnant, it is important you don't smoke or be around secondhand smoke. Don't drink and get enough rest. It's also important to get essential nutrients like folic acid, calcium, and iron from the very start. Staying active is important for your general health and can help you reduce stress, control your weight, improve circulation, boost your mood, and make you sleep better. Well, we've come to the end of today's program. Do join us next week for another interesting topic on your health. My name is Zibironke Ira Lovigbe. Bye for now.